Good day everyone, we are the Group 9 and we will be discussing about Divinagracia's Composure model. At the end of this discussion, we would be able to determine the effects of composure behavior of the advanced nurse practitioner on the wellness outcome of the selected cardiac patients. And so with that, the focus of our study population would be the adult cardiac patients admitted and confined at the Philippine Heart Center Coronary Care Unit. And the significance of this study is that nursing as a healthcare profession would prove its worth of being at par in quality performance with other healthcare professionals.
I am Lawrence Rosdamagay. I'm going to talk about the nursing theories, who is Carmelita C. Divinagracia, a Filipino nurse theorist and the former president of the Association of the Philippine College of Nursing, or the ADPCN. She is the Dean of University of the East Ramon Magsaysay College of Nursing and a member of CHED's Technical Committee on Nursing. She has been lauded for developing the art and competency of teaching nursing, and she has also been a clinic nurse, staff nurse, head nurse, instructor, assistant, dean, and dean. Next, we are going to define some terms. So what should be the requirements to become an advanced nurse practitioner? First, must be a BSN graduate, is licensed and have a clinical experience of 2 years, has undergone special training in specialized areas. And on the other hand, composure behaviors is a condition of being in a state of well-being, a coordinated, integrated living pattern that involves the dimension of wellness. Next, we are going to talk about the theory of composure behaviors. First, let us know what the letters of the word composure stands for. COM stands for competence, P for presence and prayer, O for open-mindedness, S for stimulation, U for understanding, R for both respect and relaxation, and lastly the letter E for empathy.
I am Rezuke Sagay and I will discuss further the composure behaviors. So the composure behaviors is an acronym used by Divinagracia to enumerate specific activities that must be done by the advanced nurse practitioner. COM in the word composure means competence. It is an in-depth knowledge and clinical expertise demonstrated in caring for patients. It may also pertain to the consistency and congruency of word and actions by the nurse. P for presence and prayer. It is a form of nursing measure which means being with another person during times of need, or it is a care in the form of being there during desperate times. It also includes therapeutic communication and active touch. And most importantly, prayer is highly recommended as it provides most patients with assurance. O for open-mindedness. It is a form of nursing measure which means being receptive to new ideas or reason, considering the patient's preferences and opinions related to his or her current health condition is also important. And this also includes the flexibility of the nurse to accommodate the patient's views. S for stimulation. It is a form of nursing measure demonstrated by means of providing encouragement that conveys hope and strength. This can be done by using of complimentary words or praise and smile whenever appropriate. This can also be done by giving explanation and supervision when doing certain procedures to patients. U for understanding. This is manifested through concerned and affable facial approach, and this is a way of making the patient feel important and unique. This is being able to grasp the situation the patient is in and able to show concern and compassion. R for respect and relaxation. For respect, it is a use of preferred naming in addressing the patient, respectful nods, and recognition of the patient as someone important. This also acknowledging the patient's needs, and it is better to use the words po and opo as well as nods and gestures to display courtesy. For relaxation, it entails a form of exercise that involves alternate tension and relaxation of selected group of muscles. This is also the allowance of resting periods for the patients, and these are the activities that allow use of certain muscles while the others are relaxing. E for empathy. It is accurately sensing other person's inner experience. It is also by perceiving the current positive thought and communicates by putting themselves into the patient's place.
Good day everyone, I'm Ronalyn Manaog. So today, I will be discussing to you the wellness status of Divinagracia's Composure model. So, wellness status, it refers to a condition of being in state well-being and a coordinated and integrated living pattern that involves the dimension of wellness. Patient wellness status outcome, which refers to the perceived wellness of selected patients after receiving nursing care in terms of physiological and behavioral. Now, let us define first the behavioral wellness outcome. This refers to the perceived wellness of selected orthopedic patients after receiving nursing care in terms physical, intellectual, emotional, and spiritual aspects. First is physical. The patient is able to do her daily activities and functions without signs of fatigue. It concerns or preoccupied with the body and its need. It includes muscle strength, gait exercise, and activity tolerance, and cardiorespiratory endurance. For intellectual, the patient has properly applied all the steps the nurse has instructed the patient to do. It refers to the knowledge and perception of a healthy self and ability to recognize the presence of risk factor and preventive measures. While emotional, the patient is able to handle the stresses of life and can maintain and regulate her feeling. It refers to relating to a person's emotion. It includes awareness, orientation, understanding of own and other personal feelings, and ability to control and cope with emotions. And lastly, spiritual. The patient can properly establish a value system and act upon the system. It relating to a religious belief and also defined as the development of inner self, one soul through a relationship of God. While under the physiological outcome, which refers to the perceived wellness of selected patients after receiving nursing care in terms of vital signs, which is the clinical measurement specifically pulse rate, temperature, respiration rate, and blood pressure that indicate the state of patient's essentially body functions, and bone pain sensation or chest pain, and complete blood count or hemoglobin. Thank you, and let's move on to the next reporter.
Hello, I'm Patrick Thompson and I'm a reporter for this slide. For this slide, I'm going to tackle about theoretical paradigm. First one, we have composure behavior, which consists of competence, presence and prayer, stimulation, understanding, respect and relaxation, and empathy, which leads to wellness outcome, and it has two branches, which are the physiologic outcome and biobehavioral outcome. Under physiologic outcome, we have vital signs, chest pains, and hemoglobin. Under biobehavioral outcome, we have physical, emotional, intellectual, and spiritual. For this slide, I'm going to discuss different terminologies and their functions. First one, we have assumption. Assumption is the wellness outcome of a patient will depend on the intervention the nurse has administering the client. For the second one, we have strengths. Divinagracia's model proved that the nursing as a healthcare profession have great significance in quality performances as other healthcare. Limitations. Limitations is the nurse who should only use this model must be an advanced nursing practitioner only who has undergone special training in a specialized area. For this slide, I'm going to discuss the conclusions. The socio-demographic characteristics, specifically gender and age, are related to wellness outcome of adult cardiac patient. Nursing profession can actively deliver quality caring through biobehavioral caring interventions like the composure behavior. Because regardless of creed, social class, gender, and nationality, each one needs humane, caring, spiritually oriented intervention that can facilitate wellness.